I'll do some housekeeping first, and then I'll hand over for the rest of the business. Welcome to this virtual meeting. This is a formal council committee. The proceedings will take place live on the internet. The meeting will be recorded for future viewing. It will assist the conduct of business if participants speak when they're invited. Members of the public are welcome to view the proceedings, but should not make contributions at this meeting. All participants should mute their microphones and turn off their video feed when they're not speaking. I'm led to believe that improves the quality of the ones in view and speaking if we do that. So please remember to unmute your microphone and switch on your video feed when it's your turn to speak, and speak clearly and slowly into the microphone. Anyone wishing to speak should indicate using the raise your hand button on the Microsoft Teams, and I'll invite people to speak at the appropriate time. If you do not have a hand button, please type in your request to speak in the chat function. Helen, will you keep an eye on that, please?
Yes, Chair.
Thank you. And I ask everyone's patience with the use of technology, and I apologise in any advance if we experience any unforeseen difficulties, which we'll try and resolve as quickly as we can. I now follow the items of business set out in the agenda. Agenda item number 1, apologies for absence. None?
None received, Chair.
Thank you. Agenda item 2, to report the appointment of any substitute members serving for this committee. That's inappropriate. Agenda item 3, to receive any declarations of interest under the Members' Code of Conduct. Are there any?
None.
Thank you. Item 4, to confirm and sign the minutes of the meeting held on the 27th of July as a correct record. Can I sign those? Thank you. I'll take silence as an agreement then. Agenda item 5, the scrutiny review, the council and partners' response to the COVID-19 pandemic. I'm going to hand over now to Kevin O'Keefe and Nick Barlow for a quick introduction. Kevin O'Keefe, Chief Exec. Thank you, Kevin.
Thank you, Chair. I hope you can all hear me, but if my voice drowns out over the ether, please let me know, and I'll speak louder if necessary. So I've got with me Barry, who's going to lead on the report, but I thought it'd be quite useful to contextualise that report with a few sort of words for myself and a bit of a helicopter view. Now, plainly, this is a scrutiny committee, and you will make your own judgment on the effectiveness and efficacy of the council's response to the extant crisis. But it would be remiss of me not to give my own reflections in respect of this report, and indeed the penultimate report on your agenda today, when that time comes on the agenda. In my 20-year odd career in local government, it's certainly been the case that emergency planning is usually sat within my directorate in one incarnation or another. And I suppose the thing about emergency planning is it's one of those things you hope you'll never ever have to rely upon, and it's a case of planning for the worst, yet always hoping for the best. In my first 10-11 years in local government, I was at Herefordshire Council, where we always planned for the worst and hope for the best. But being Herefordshire, and members of the committee who are familiar with Hereford will know it's very susceptible to flooding, and therefore all of our emergency planning was centred around flooding, and we were never failed to be amazed at the fact that every year that we planned for it, and it always happened. And therefore we became very good at handling flooding and the response to flooding. But we also had plans for things like aircraft falling upon the county, trains falling off the track, and indeed a pandemic. And I'm very much reminded of when I went to the counter-terrorism unit for a briefing with other chief executives and the chief constable about 9-10 months ago, that the chief executive of Wiltshire Council was giving one of the keynote addresses as to how they actually reacted to the Novichok poisoning that took place in Salisbury within their area. And one of the key things that stuck in my mind from that was that he said there was no blueprint. It wasn't quite an epidemic, and it wasn't a chemical spill. It was somewhere between the two, but they relied entirely upon their emergency planning colleagues in order to understand what this evolving and dynamic situation was about and react to it. None of us in this meeting today, I suspect, has ever encountered a pandemic, least alone those of my emergency planning colleagues. And it
Chair.
would be, yeah.
Sorry, Chief. Sorry, Chair. Can I just interrupt? There seems to be an issue with the meeting link. So there are people trying to get into the meeting. So do you mind if we just adjourn the meeting for a few moments while we try and get people into this meeting?
Yes, that's fine.
Is that okay?
That's good with the chair.
Is
That's
that
fine,
okay, Chair?
Ellie, that's fine, Ellie.
Okay. So if we can just hold fire just for a couple of minutes, just while I try and get this sorted.
Okay, thank you. Just tell us when.
Okay. Sorry, Chair. I think that has been resolved now. So if you want to carry on.
Thank you. Thank you.
Sorry about that. Sorry about that.
Okay, Kevin, over to you.
Yes, thank you, Chair. I think the point I got to was contrasting the emergency response at my days in Herefordshire Council, where we planned for flooding, which happened every single year. So we were probably incredibly well versed to dealing with flooding and understood that the catastrophes that would occur. And I was comparing that with my colleague, the Chief Executive at Wiltshire, who, when faced with the Novichok poisoning, which took place some years ago, that they had no plan for that sort of thing, which is hardly surprising. But they sort of, their emergency planning colleagues melded a blend between a chemical spill and the way they might react to a chemical spill, to a pandemic and the way they might react to that. But there was no blueprint. And certainly colleagues at Dudley have got plans for pandemics, which none of us would have thought when I took up post last year that we ever need to operationalise. But unlike in Herefordshire, where the emergency plan for flooding is an annual event, it's well rehearsed, it's well studied, it's refined and finessed, we'd never had a pandemic. But it would be remiss of me to preface the report that paying tribute to our emergency planning team led by Barry. You'll see from the report that it's 2.5 FTEs that lead on emergency planning for us. It's the thing you keep in your back pocket you think you'll never need to use, but by golly, when you do need to use it, it's the effectiveness of that planning that makes all the difference between a success and a disaster. And really, I take my hat off to them for the incredible job they've done on behalf of the council, the community, businesses and the borough in the way in which they have delivered and finessed a plan for which there was no clear blueprint. I'll revert to type now and again put my lawyer's hat on by referring to the Civil Contingencies Act, in respect of which the council is a Category 1 organisation along with our colleagues in the blue light services and indeed the NHS. And some of our key responsibilities as a Category 1 responder are to ensure that we are continually assessing risks of various emergencies occurring, be it aircraft, God forbid, crashing onto the borough, trains falling off the track, pandemics, flooding, and so on and so forth. We are also empowered and required to devise emergency plans, to share information with our partners, and to provide assistance as and when required to our communities and our boroughs, and our business, I should say, within the borough. So from my perspective as Chief Executive, and I'm here to present the helicopter view of this report, I could not be more proud of the way in which our emergency planning colleagues have formed a cohesive bond with our partners and communities in the borough in delivering the outcomes which we have delivered so far. At that stage, Chair, with your leave, I will pass on to Barry, who is the author of the report, but I felt it incumbent upon each report to be presented in my name in order to ensure that the corporacy of the response was underlined from the top. Thank you, Chair.
Thank you, Kevin. Can I just ask Nick Barlow, Cabinet Member for Health and Adult Social Care, if you want to say a quick few words, Nick, before we get into the reports.
Thank you, Chair. Hope everybody can hear me. Chair, thank you for inviting me along this evening. There's very little for me to add to what Kevin has already said. The past 6 months have been turbulent, traumatic, ever-changing, and it has affected every single member of the council, affected every single member of staff of the council. And like Kevin, I wish to make wholehearted thanks to everybody in public health, emergency planning, and also to get right across their work they've done to keep the people of Dudley as safe and as well as we can do. It is one of those things that, you know, we couldn't have told what was happening at the start of the year. We were all busy leading our lives, planning elections that we were going to hopefully win, and then suddenly that all went out the window. Officers adapted to the situation with the blink of an eye, whether they were reassigned to other duties, supporting people that need assistance.
Nick, this is the chair. I'm sorry, but you're fading in and out. So
sorry, yes. Sorry, I will try
Thank
and
you.
sit. I'll try and sit a bit closer. Sorry. Really, what I'm trying to say is that everybody has adapted to the situation as well as they could have done. We have planned, but we have adapted to the situation, and sure that part of this committee this evening will look at what our planning has done, procurement, the health team, education, and I'm sure that there are perhaps things that we could have done better, swiftly, but that I think that we've done an incredible job quite.
Nick, it's Chair again. I'm sorry, you're fading in and out to the point where it's hardly audible.
Right. Chair, I've really finished what I was going to say, and I think it's important that you listen to the officers and what they have to present, Chair. So I'm going to hand over to them now. Thank
you very much, Barry. We come to your part of the presentation now, please.
Thank you, Chair, and thank you, Councillor Barlow and Kevin. Obviously, you've all had the paper, and if it's okay and if technology allows, I have done a presentation. If that may be, if I can share that, if that's possible. Otherwise, I can simply just go through the paper.
Helen, this is a chair. Is that possible, please?
Yes, Chair. Barry, do you know how to upload it to the screen?
Yeah, it's just click the box, I think, is it? Lovely.
Yeah, that's right. Yeah,
great.
Yeah.
Just bear with me a second. Can you all see that, and can you all hear me as well? I suppose is the other thing.
Yes, we can, Barry.
Great. Thanks, Chair, and thanks everybody for this opportunity again. I'd just like to add that Fran Hyde from our emergency planning team is here as well, and also Dr. Mayada Abarafan from Public Health as well, who may chip in at some point. Obviously, you've all had the paper, and rather just go through the paper word by word. I know there was some specific points around the planning that took place before the pandemic, and also some interesting exercise parenthesis. So I'm going to focus on a lot of what we learned from that event, and also just to go through some of the structures in place that protect us on a daily basis. And I know Kevin said not many of us have been through a pandemic. Sadly, I have before, not as to the extent of this one, which was a blessing, but I was also involved in swine flu in 2009. So sadly, when you get into this job, although we hope for the best and plan for the worst, sadly, we plan for the worst and expect the worst a lot of the time, unfortunately. So it's just, you just change your outlook on life, I'm afraid. So what I just wanted to run through was just a bit about the structure in place. So today I'm going to focus mainly on the emergency planning team, but I think it's important to understand the whole system. And as Kevin highlighted, the emergency planning team focus on the Civil Contingencies Act and our planning for incidents, be they major incidents such as a flood, a major disaster, also the slow burn kind of incidents such as pandemics and events that lead to excess deaths as well. The other part, and that is the 2.5 whole time equivalent, the other part of the team are our infection prevention nurses, and they're specialist nurses who on a daily basis prevent outbreaks occurring, check standards across health and social care, from primary care to care homes. We support Dudley CCG in their infection control requirements and standards, and make sure that the standards are in place, and if anything does happen, we support those individual institutions and partners across the system. And both sections really have been working flat out since well, a lot of us since February, to be honest with you, to make sure that we were prepared and put plans in place and how we deal with COVID as we are at the minute. So just a little bit about the arrangements in place that are what we have for pretty much any incident and some of the governance structures that we have. I suppose these are the main groups that we deal with, and the multi-agency group is the Dudley Health Protection Group, and that involves partners from across the system, from health and social care, from our CCG colleagues, colleagues from Public Health England, from NHS England, and CQC, as well as some of our providers as well. And the aim of that is a group that's ideally is there to make sure that we are assured as a local authority and as for the Director of Public Health that we are prepared to deal with incidents and outbreaks, be that small one to a major incident as well. That group also oversees the Health Protection Cooperation Agreement, which is discussed in the paper and we'll touch on again in a little while. The other internal group that we have is the Business Continuity and Emergency Planning Group, and that was a group that we established when we took over the emergency planning, because we recognise that there really needs to be a much stronger focus as a system on emergency planning. And what that group does, it has representatives from across the council at a senior level. And the idea of that group is to plan and prepare and make sure that we have our processes in place for events, but also to meet our requirements under the Civil Contingencies Act. And the other group, which interestingly we reformulated just prior to the pandemic, was the Dudley Resilience Forum, and that group again is a wider partnership group. It involves colleagues from health as well, but actually involves wider colleagues from the voluntary sector, from town centres, from businesses, from colleges, and the idea is it's to sort of get that message across, that mutual support if incidents happen, how we can work together. And we've certainly seen those partnerships and those links really important when we look at things such as the mobile testing unit, where Intu supported us really strongly from the beginning when we needed to put something in place quite quickly. For me, and one of the key things from the beginning for the response to COVID, and actually the response to any incident, I think it's important to say, it is around our processes. And for me, there are a couple of key processes that should respond, and it deals with what the government said that our responsibility was when we moved back into the local authority, to deal with instances that are small to dealing with those major incidents as well. And part of that is our Dudley Health Protection Cooperation Agreement, which sets out everybody's responsibility within the system in our main players. It sets out who will do what. It sets out including how we'll deal with flu outbreaks in a flu outbreak on a seasonal basis in a care home, to how we all deal with a pandemic. It also is a signed agreement, and it was really key to how we mobilised our resources at the very beginning of this pandemic, and before a lot of the guidance came out from central government. So we were ready with a plan and how we would move forward. It also has the governance structure that you would need to put in place, and who would chair the meetings and who would do what and when and how. So a really vital, important document, really. The other element for me, and something that my team and the emergency planning team have been really working hard on, and something that we committed to at the very beginning, was around ensuring our business continuity plans are in place. Because our business continuity plans should help us as a local authority and others across the system, regardless of what the incident is. So it deals with if you lose staff. It helps you identify your critical services and recovery of those critical services. It helps with if you lose premises and infrastructure. And business continuity planning has been vital. And a lot of the work that we've done as a team has been around making sure that those business continuity plans are in place across the system, are fit for purpose, we're developing the process further and also are tested, and make sure that if we do have an incident, then each part of the service knows what they need to do and to keep that service running and identify what a critical service across the council. So that's just a bit of an overview of, you know, in a few slides really, how the system works. The other thing that I know that people were really interested in was exercise parenthesis that we did. Now, exercise parenthesis last year came about firstly because we recognised that the local authority, for us anyway, and for me, our pandemic flu plan was needed updating. The problem we had was that there had been no new guidance for a considerable period of time. So we made a decision through the Business Continuity and Emergency Planning Group, supported by the Director of Public Health, and the Health Protection Group, that we needed to formulate and develop an exercise. And we were key that it needed to include all our partners, because everything we try to do together as much as we can. So it all developed learning. If you I'm a bit of a history bore, and parenthesis is developed from Hippocrates in 412 BC. It was the first time I think the flu was first described in an outbreak in modern day Turkey, but that's where the name came from. But the important thing for me was the learning we tried to get from it. And as I say, it was a joint exercise that was planned by us in conjunction with Dudley Group of Hospitals and Dudley CCG. And we had a lot of support from Public Health England. I think that was important in formulating the kind of questions and responses, as well as NHS England as well. But we wanted to include the wider partners in the day. And these exercises take place quite a lot. What we wanted to do was make sure we included people that you wouldn't normally think about included in this, to make it as realistic as possible. So we involved, it might seem really left field, but funeral directors. We involved coroners. We definitely involved the police, because we thought it was really important, as well as wider partners and observers. And obviously, we invited elected members, and I know that Councillor Baton was there on the day as well. We wanted to really make sure that we recognised that the pandemic was overdue, or could occur very soon, and how that would impact. But we knew that if we're going to fight this, as we have done, we needed to do it together and try and support each other. So what we wanted to do was mimic the structures and governance structures that have in place, and how you would deliver operational items that are really critical. Because again, for some of us who've been involved in these before, there's a lot of theory involved in this, but sometimes it doesn't get to the practical needs of what needs to take place. So the event focused on an outbreak that developed in China, a short space from Beijing, and the reason I thought that would be a good idea because it's an international hub for travel, and it involved a spread from an animal vector to humans, causing widespread infection. And we wanted all of us to get different things from the day. I know the Dudley Group had a real urge to try and update their plans and make sure they were fit for purpose, as did we. We also wanted to stress test staff and pressures on staff across the system to see how would we cope with the loss of staff and loss of resource. And one thing that we also wanted to test, that again is sometimes that it isn't one that you really want to talk about often, but it is really important, is how we care for those who were affected in the worst case scenario from this, from those who die with dignity, and how we look after our own as best we can. So they were really key for us as an event. So we focused on a rising tide event with increased sickness and absence. And I think it's important because a lot of emergency planning deal with incidents that happen really quickly and have to mobilise resource quickly. And as discussed in the paper, it discusses around the emergency plan. And a lot of the emergency plan deals with that quick incidents, quick mobilisation. But we wanted to focus on something that is, although it's happened quite rapidly, we have a little bit of time. So it was a rising tide event. And we wanted to focus on how we can try and maintain services with increased sickness and absence. We really wanted to focus on pressure on the NHS, and also the need for the ITU beds. We wanted to deal with public confidence and anxiety and potential public disorder as well, and how would we deal with those issues. A lot of these incidents focus on elderly, as we did in this one as well, but we also wanted an impact on children, an impact and outbreak on schools and school closures, and what would that mean as a system, primarily for our staff, and how we would manage staffing and how we would deal with those different issues, and also impact on social care and social care staffing. And again, as we've mentioned about excess deaths, now we deal with that. We asked the delegates on the day 4 simple questions. What were your immediate actions? What are your priorities? What do you need from others? And also, how you implement your decisions. And I suppose there was a lot of takeaway learning that all of us had on the day. And some of these things you'll probably pick up on from what's happened since. So there was a real learning that we really needed clear internal and system-wide command and control structures with appropriate governance processes for each organisation. The need for a system-wide approach. The importance of business continuity planning for all of our organisations. How to manage staff sickness and absence. Which services to halt, because obviously in the pandemic we have to focus on our critical services, and messages and the comms and how important communications were in any process, any pandemic, and I know there's a comms paper, but they've been from the off, they've been the key and essential to this. The importance of communications being clear, concise, consistent messages to our public and staff, but also make sure we had good communications with different sections of our community as well, but also the fact that we need to manage expectations. How patients will be cohorted and we create space and capacity across the system. And again, I know Matt's in the meeting, Matt Bowsher, and there was a real push at the very beginning that how we create capacity in the system and how the hospital and the trust would cohort patients. And also how we would amend the strategy as things evolved to focus on our vulnerable and safe where we required it. And redirection of staff and resources. And also the training for them to be redeployed. And a lot of what our team have been doing over the whole pandemic is a lot of training and supporting staff so they feel confident and safe to carry on with the services they've done throughout the pandemic. Again, there's a paper on PPE, and one of the key issues was the need for PPE and how it would be effectively used. And again, a lot of what we did, and I'm not going to steal Rosie's thunder, but a lot of this at the very beginning was make sure the staff were trained and knew how to use the PPE, and we tried working together to get PPE at every opportunity. The importance of briefing councillors and MPs regularly. Obviously, you may have views on that. I think the one thing we have to say is that a lot of us have been really busy and really rushed, and sometimes you may have how you feel about that and how you feel you've been briefed, but sometimes for me it's something that in the heat of the moment, I don't know if you feel the same, that sometimes it may be neglected, but I know that Bal, as the Director of Public Health, and Debs before have done their utmost to keep councillors and MPs briefed, and actually the new systems put in place around the Health Protection Board, etc., have supported councillors, etc., and getting information out. The one thing that was really important, and something again has been in this pandemic, is involved the voluntary sector from the start, and Dudley DCVS, and in the response from Dudley Group when they supported the initial community swabbing, British Red Cross supported that. Dudley CVS have been key to a lot of the things we've done, especially with our vulnerable groups and protecting the shielded, and they were there from the very beginning when the pandemic hit. The need for expansion of NHS 111. Improving the process for those who have died, and it was around capacity, registration processes, and again, for me, that was something that has been really well done. If I was being, to put it simply, that how we've worked together to improve that. The need to make a decision on a crematorium. You may be aware that one of the crematoria were due to be shut for upgrade, that decision was made following this event that we would, and when the pandemic started, that we'd wait to see what would happen. The possibility to use hotels which allow isolation for those affected, and again, as a model of what we've done in Dudley, that's exactly what we did for anybody who needed that. Importance of early clarity of requirements from national and regional bodies. Again, perhaps everybody may have different views on that. I think, as Kevin started at the beginning, it's sometimes very difficult to know, and this has been an evolving situation, and we've had to evolve our guidance, and as the government have they've gone along. The importance of data and the need to support staff and the public, and I think that's important, especially going from now and after winter into the recovery from this. I think the key learning for me has been around the importance of how we work together, and people who were there on that day, and there's some people in this committee who were there on that day, the links that we made on that event really saw us through the pandemic, because especially in big organizations, we send a lot of emails and you never put a name to a face, but actually that day people got the opportunity to do that and actually build relationships that we've still got in place that have helped us through the pandemic. But also, we also know that before national guidance came out, it helped us focus and establish command and control. It helped us put theory into practice around mobilisation of resources. And it provided clear operational priorities, especially when we're looking at what we would need to do for those first few cases and how we'd work together using the cooperation agreement and work with staff from Dudley Group and across the voluntary sector. For Dudley Group, I know it led to a full review of their pandemic, influenza and excess death plans as well. So just briefly, I just thought it'd be worth just thinking about, well, what next for us and where are we now? I think the one thing we have to think about is that at the minute we're still in the middle of this, and this is the graph from the pandemic flu of 2009. H1N1 swine flu, and as people who are involved in that will know, there was an initial epidemic curve, and then we saw a second spike, and what we're in the middle of trying to do now is prevent that second spike or to flatten it as much as possible. We've also got to think about, especially for the emergency planning team and for us, is about winter preparedness. You know, hopefully winters are getting milder, but we can't be sure of that. And we need to make sure that our critical services function through the winter period and how we support the vulnerable again. We've also got to think about influenza. The government have announced an expansion to the flu programme, and we're working flat out as the Dudley CCGR and the STP and with colleagues across the system to work out how we can improve uptake and initiatives to support each other to make sure that we do that. And actually, a lot of what my team will be doing, we're dealing with some of the things that come back every winter. So one of the things that we'll have a real issue, along with flu, are things such as those winter viruses that cause diarrhea and vomiting and affect our schools, our care homes, and our workplaces. So a lot of the work we'll be doing will be around that as well. And I just think it's important to mention that, as well as all the other things we've been doing around COVID that are highlighted in the paper, especially the emergency planning team, they have to maintain that 24/7 response to incidents such as the fire we had at the Clawton Centre. So they are there working around the clock, as are our SEB board as well, to make sure that we have that response for any incident and not just COVID. Moving forward, I think one of the things, and it's highlighted in the paper again, that we really want to do is, obviously, there's going to be so much learning from this. One of the keys that every local authority has always needed was a pandemic flu plan. Obviously, that's probably definitely going to change, I would have thought. But we will update our plans with all the learning that we've had from this and make sure they're fit for purpose moving forward. We've already decided that we want to strengthen our business continuity planning process. We've done a lot of work and we've got business continuity plans across the whole of our local authority, but we want to make sure that they are really well, they've already been tested, but what we want to do moving forward is make sure there's a regular testing of our plans and they are fit for purpose and reviewed regularly. And the other thing we want to do is continue to evolve the role of elected members. We've sort of had a step change move since we took over to try and involve as much as possible elected members in any events we do, in any training sessions we do. We want to try and evolve the training that we've got in place at the minute, and it's discussed in the paper, but really want your input into that. And the other thing is your views on how you think you could be involved and how you think things should be done. And because your links to the community are vital, and your knowledge of the community is really important to how we progress things, not just on emergency planning, but things such as influenza and flu vaccination. And there's lots of different things really that we'd really like your support on. So that's really it for me. And it was just if there's any questions and anything on the paper. Thank you.
Thank you, Barry. Questions? Any members of the committee who wish to put their hand up, or hang on, we've got some. No. Any questions for any members? Can't see any hands up.
Councillor Kell was first, Chair.
Councillor Kell, yes, thank you. Jackie Kell.
Thanks, Chair, and thanks, Barry, for that. I just wondered, in terms of the emergency planning staff, do we actually have sufficient now? Do we think that we've got a sufficient team? I know that we've got through this pandemic so far, but we've got relatively small numbers, and given this sort of the ongoing nature of this, are we going to have sufficient numbers going forward? That's the first question.
It's a very interesting question. I suppose how much is enough is the question for this. I think one thing that we are looking at, and I am so proud of how my team have worked pretty much 7 days a week trying to fight this infection. I think we've recognised that it's not sustainable, that we need more resource, and actually work is taking place to try and do that, I think is what we would say. I think the problem is that what we do doesn't grow on trees, if you know what I mean. And sometimes we can get staff in that and actually are a hindrance because we'll be spending more time trying to develop those staff. I think sometimes it's using the wider workforce that have some knowledge of the areas we talk about, and involving them and engaging them more across the wider council, actually. And I think that for me, would I like more staff? Well, obviously, anybody ahead of service say, well, thanks very much. Yes, so it would be great. But I think the important thing is recognising, as Kevin said at the beginning, we're a bit of a Cinderella service. I used to be a ward manager many years ago, and if anybody mentioned business continuity plans to me, I think, oh Lord, because I'm too busy delivering services. But I think it's that recognition and recognising the importance of those plans, and actually taking ownership within each service of those plans, that will make our job easier and move forward to deliver all the things we need. But we have put, it wasn't actually, the team was 2 staff at one point. It is 2.5 now, so we have recognised it was an additional resource. But I think the thing for us, it's that the wider public health and the wider local authority staff as well supporting us on some of these issues, which we've had a very discussion about today, Councillor, to be fair.
Okay, thanks. Just one other question for now. I just wondered how often the business continuity plans are going to be reviewed. Sort of, how often have they been reviewed in the past, and how often do we intend to do it going forward?
They should be reviewed at least annually. If I was being 100% honest, one of the challenges we've had is getting that done, because again, it goes back to the thing, it's out of sight, out of mind. But one of the things that we've had real support of from the Director of Public Health, who's the chair of the BP group, and actually from Seb as well, is to make sure, and a real push to each service to make sure that those plans were in place. And I think it was good in a way that we did that work, because from the very off in February, when we knew this was coming, Kevin and Seb said straight off that it's our business continuity plans that are essential and they need to be fit for purpose. And that direction was sent straight away. So we had, I think in February, we had one business continuity plan that was outstanding, and that was probably just an oversight in admin rather than anything else. But what we want to do is make sure that they are fit for purpose. And so what was agreed at SEB is that when they're reviewed, they're checked by senior staff and they're signed off, and then we will do a second review and also help support and test those plans.
Thank you. Thanks, Chair.
Sorry, Chair,
You're
you're
on
on
mute, Chair.
mute.
I'll go Kathy Baton next, Councillor Baton, and then Kevin O'Keefe. Kevin, was your point regarding something that's just been said?
It was actually, Chair. Yes.
Can I take you first, then, please?
Yes. Thank you, Jen. It's something that Councillor Carroll's raised, and that's about the numbers of staff in various areas. And what I always say is that I know Barry and I met early on when I joined the council. As I mentioned earlier, emergency planning is sort of in my DNA. It's always been in my directorates in various iterations. And one of the things I sort of mandated was a push to ensure that we had business continuity plans throughout all services in the authority, which as the proof is in the eating as far as those were in place, as Barry indicated, so that we were in a state of high preparedness for whatever eventuality incurred. But in just the one point I really wanted to raise as far as Councillor Carroll's points is that emergency planning doesn't sit within 2.5 members of staff in emergency planning. It's a bit like equality and diversity. It doesn't sit within equality and diversity, and health and safety doesn't sit within there. It's a system-wide approach that every single member of staff is engaged in. We're led, supported and guided by Barry and his team, but this is a system-wide approach that everybody, every head of service, every manager must own the business continuity and emergency planning agenda. And therefore, the number of staff who are there as the catalyst to propagate that debate and that drive forward is in no way the sole and only asset we have. The asset is every single member of staff must own this, as I think has been the case in the course of the last 5 or 6 months. Thank you, Chair.
Thank you, Kevin. Councillor Kathy Baton, please.
Oh, thanks, Chair. Sorry, there was a bit of an IT delay. I've got just a comment and then a couple of questions, if I may. So I think absolutely our hats and untold thanks go to the incredible work that the emergency planning team did throughout this. You know, when we look at the whole raft of work that they undertook, including the infection control work, which has been ongoing, you know, I think they've done an absolutely sterling job. But a couple of questions really for Barry. So when you undertook exercise Perinthus, you commented that was because national guidance hadn't been updated, or we hadn't had any new national guidance for some considerable time. How, in terms of our local plans that came out of Perinthus, how much control do we have over our local plans versus the national guidance? So where I'm coming from this is very early on, we put our own local test, track and trace in place. Or well, we highlighted a facility where our own test, track and trace could take place from. And then on government guidance changed very quickly, and then our plan got scrapped. So I just wonder how much can we own locally of our emergency plan? And the second point is around elected members. And I'd sort of suggest that really there should be a basic level of knowledge across all elected members. But then as we move through shadow cabinet and ultimately leader and shadow leader, that level of knowledge and expertise and involvement should reflect as they move through. And I'd be interested to know in terms of, and it's probably a question for Kevin actually, in terms of the SEB board and political leadership and guidance through that. Should the leader sit on that, or is that something that is just purely operational?
Shall I take the first point around how we can influence plans?
If you will, Barry, because Kevin's got his hand up as well. I think.
Yeah, I think you're right in what you say. Some things we can't influence and make changes to. Some things we can. Regarding the drive-through issue, that was actually obviously we supported the CCG and the STP in those plans, and because of how resources were implemented, yeah, the decision was made to change. But I think we can do things our way in a way, and there's some real examples through this pandemic how we've done that, and just a couple of examples is that how we supported initially getting response out to testing individuals using our district nurses, supported by the trust. We trained them to support them because obviously the resource they were under pressure as well. The element of guidance came out around from the government around what PPE should be worn. We had issues with some of our staff who were really worried, and we supported them and developed local guidance that enhanced that support for them, really. I think that one of the key things that we've been waiting for from pandemic is how we would deliver a mass vaccination if it comes around, or any other issues, which is always something that you think about in a pandemic situation. And we didn't touch on it in that presentation but we've looked to even identify locations and working with pharmacy colleagues in the CCG. So it's a nuance really, in that the government will give you a guideline, and as famously say, it's a guideline, not a policy, and it's how we interpret that and what we do with it and what is fit for purpose on the ground for us is how I would say. So some things we have to do, it's mandated. We have no control over, for example, we have no control over lab capacity, but how we use what we've got is down to us in a way.
Can I just come back on that, Chair?
Yes, Kathy.
I think that's really reassuring to hear that actually we can create a plan which is fit for purpose for the residents of our borough, because I think it's really important that we understand our communities and that our plan can robustly protect those communities, and maybe the fact that we've done so much better than some of our local our neighbouring authorities would actually reflect that as well. But that is reassuring to hear that our plans will be predominantly, apart from what we're bound by, will be predominantly Dudley centred plans.
Thank you, Kathy. Kevin, did you want to comment on that?
Yes, I'm slightly at a disadvantage, but my reception froze and I heard part of what Kathy was asking me. So if I can make sense of the bit that I heard before my signal broke up, in terms of communication and involvement of senior members, it's my practice to have a weekly briefing with the leader, which unsurprisingly, as a barometer of the pandemic, looking at my Outlook diary, probably 4 or 5 months ago, 98% of my Outlook diary was COVID related work. And therefore the content of my briefing to the leader was COVID related. I equally have, and I can see that Councillor Foster had joined us previously, that I was in a position also to brief Councillor Foster or Councillor Zada as the group or deputy group leader for the Labour group, again on a weekly basis of those things which were pertinent at that time. SEB was meeting, that's the for members of the public and press that might be joining us. The acronym SEB is the senior executive board of the council. To myself, I chaired my directors. We were meeting 5 days a week, and that was following meetings of the chief executives of the region that were meeting at the beginning of the crisis, 7 days a week at an 8 o'clock call to make sure that we got the key messages out, not just to the lead of Dudley Council and to his shadow, but also to ensure that common messaging was clear across the piece. I don't know, Councillor Baton, if I missed any other part of your question. If I did, if you could repeat it, because my reception broke up.
Thanks, Kevin. I think really the question was more around. So you've explained what happened and how you briefed the leader and the leader of the opposition, and I suppose the question is, if we project forward, is that a satisfactory arrangement going forward, or should there be more political and elected leadership involved at that strategic level? And it might be an open-ended question that you might not be able to answer, but when we're talking about the role of elected members within emergency planning in the future, is that something that we need to consider?
Well, resorting to cliched words, I think we've heard a lot over the last few months. These were unprecedented times, and certainly both the leader and his counterpart, the leader of the opposition, gave me executive powers to act on that executive basis for non-controversial decisions that need to be made during the course of the height of the pandemic. I think that worked well. There was no democratic deficit, because there were obviously very clear lines of engagement with which I could work, and certainly those were paralleled by the chief execs elsewhere in the metropolitan boroughs within the West Midlands. So I think that worked well, but I'm not going to say that in the 5 days that led up to lockdown that every chief exec, including myself, got that balance right. And I think there could be lessons to be learned going forward.
Thank you. Kathy, have you finished questions at the moment?
Yeah, thanks very much, Chair.
Thank you. I've got two hands up. First one is Mayada Abwafan, Adults and Older People Public Health, and the second one is Fran Hyde, also from Health. Mayada, please.
Hi, thank you, Chair. I just wanted to comment, just add a comment on factors which affected our success in managing, or we're not out of the outbreak yet, COVID, but we have the lowest rates, one of the lowest rates amongst in the West Midlands. It's our cooperation agreement. We had this agreement for many years, and all our partners knew what is their roles and responsibilities. So we managed to mobilize resources, as Barry mentioned, like school nurses are commissioned by public health, but they have been deployed to do testing, and also mobilizing finances and altering commissioning arrangements. For example, the CCG added to their courier services that courier can go into care homes and deliver and bring back COVID testing. So this has had all this really have enabled us to really manage this outbreak in a better way. Thank you.
Thank you, Mayada. Fran Hyde, Health Protection, you're next.
Thank you, Chair, and thank you for allowing me to attend tonight, everybody. It's just to feed in from what Barry said, really. I'm part of the emergency planning team, and it's just to say that one of the immediate lessons that has come out of this, even though we're still only halfway through the pandemic probably, is the fact that we do need more joined up working, that the emergency planners need to come alongside the elected members more. So we are looking to develop a package, an all-in-one, a one-stop shop, if you like, that we could maybe tie into the elected members portal, so that everybody from the first day they're an elected member will have more information on that portal to do with emergency planning. But we are looking to hopefully develop it in line with yourselves. So obviously with consultation with yourselves so that we can develop it so that it is bespoke for you and it actually covers what you need rather than what we think you need. So it's just to add that in, that we have recognised that and we are hoping to work on that as and when we can. Thank you, Chair.
Thank you, Fran. That's reassuring. Councillor Steve Waltho.
Thank you very much indeed, Chair, for that. I want to put a slightly different slant on the discussion, if I may, and it really brings into question the absolute purpose of this scrutiny process, I guess, looking at the list of people that we have here tonight. And I'd like to sincerely thank Barry and Kevin and all of our officers for their considerable input. It's clear we've had quite an impact here in Dudley, as has been said already. But if we are going to have a kind of a real warts and all discussion and how each partner feels that their area of responsibility may, have had difficulties along the way or ways that we can improve the overall process. What I'm saying is I don't see anyone here tonight as a participant from, say, DCVS, directly from DCVS tonight, who had a major input into the pandemic, as has already been said. I think I've seen on the list here tonight participants, our friend Neil from the CCG, I've seen Jane from Health Watch, but again, I've seen no one directly, I don't think, from our other major partner, Dudley Group of Hospitals. I may be wrong. And really, I just wanted to make that point, really, as we need their input surely within this scrutiny process, and things that went wrong possibly along the way, or things that didn't go as well as they could, so we can improve the whole process for the future. Thank you, Chair.
Thank you, Steve. I think it's fairly evident from what we're hearing from our officers that as many partners as we can get around the table, the better we'll be fitted to deal with any subsequent surge if it comes along, and then of course any pandemic in the future. Now, are there any more councillors or any more partners who wish to add anything to this part of the discussion, please? I see none. Helen, can you see any?
No, Chair, there's no comments and there's no hands raised.
Thank you. I'll start to round up then, if that's okay with everybody. One question one suggestion I'd like to put forward is when we become councillors, and many of us have been here a long time, we never knew anything about emergency planning, and it wasn't something that we talked about in the tea rooms. But what is clear now is that we all need to be part and parcel of the training regime going forward. And I think when we become councillors, we get financial training, we get training on the Constitution, health and safety, equal ops. Kevin's already mentioned all these across directorate events. And I think emergency planning should be one of those where we get some real input as new councillors, or if we've been here a long time, some refresher training. And it wouldn't be a bad idea at some point, if we could afford it and if it was thought feasible, to make emergency planning training one of those mandatory trainings regimes that we go through. So I don't know if anyone wants to comment on that. Barry, did you want to?
Yeah, from our point of view, Chair, we'd be more than happy with that, and we'd more than happy to support that as well. I think what we'd like to do is support it how best you feel it's appropriate, really, is what I would say. But more than happy, really, for us to support and to deliver that training. And it goes a bit to what Fran was saying earlier, and how we will do that and give you some resource to give you better, to help you understand it a bit more. And the other thing I'd say is, it's a bit of a virtual door now, but our door's always open. So if there's anything or any queries or anything you need, you can always contact us as a team. And we are due to move location from Himley into Dudley. But again, we're more than happy to speak to all councillors, any councillors, if there's any issues, or if you just want to know more about how the process works on a one-to-one basis, as well as in a formal setting as well.
Thank you. I've now got
Sorry, Chair, it's Kevin here. Just to let you know that in addition to the 2 hands you can see electronically raised, I think Councillor Millwood is raising a hand as well.
Yeah, I was just going to call her Kevin. Councillor Anne Millwood, please.
Thank you very much, Chair. For some reason, I don't have facility to raise a virtual hand, so I've put my real one up. But no, I fully agree with what you say, Councillor Tyler. And years ago, we used to have emergency training and a refresher every year. We used to have a lot of training, actually. And it's always been a passion of mine that when you're elected or re-elected, the training, and I'm going off tack a bit here, I don't really mean to, but it is a real bee in my bonnet that I don't think a lot of the training that we have or induction is fit for purpose anyway. And I think that a lot of us as councillors can have an input into what type of training we want and we need. And as one of your previous speakers said, she was keen on us having that training and that access about things that really are pertinent to us and what we need rather than what the officers think we need. So yeah, I fully agree with what you say, and we do need this ongoing training and updating. So thank you for bringing that up, Chair.
Thank you, Anne. And it's right, because if we don't improve on what's gone on in the past, then we haven't really been listening, have we?
No.
All right. So I've got Councillor Elaine Taylor next, please.
Right. Okay. Can you hear me? Yeah.
Yes.
Yeah. I've got to endorse everything what's just been said, and Anne's just hit it in a nutshell. There's got to be different types of training that are fit for purpose. Some of us are not going to be able to be part of and able to be part of some of the training that could be offered. But there is still information there that we need when we to relate back to our residents. And sadly, that was the part that I missed. You know, I was having calls and I didn't know the answers. So luckily, we've got people on the other end of the phone, and I was able to seek that information. But daily briefings, those are something that we need, especially at this sort of time moving forward. That was what I think was lacking right at that point, you know, when the pandemic was at its highest.
Thank you, Elaine. I've got Councillor Chris Neal and Councillor Cathy Baton.
Yeah, Chair, sorry to butt in. Yeah, I just really want to agree with what you've already said. We all had a discussion about it before, didn't we? And we said that a lot of our residents rely on us really to disseminate information, and it would be better if we were more in tune as to what we should be telling them rather than what we actually were telling them, what we thought we should be telling them. So really, I know it goes back a few questions ago, but I still agree that I think this should happen so we've got a better idea of what to tell them.
Okay, thank you, Chris. Cathy, did you want to come in again?
Yeah, just obviously to endorse the mandatory training and the refresher and update training, but I'd just like to return to my earlier points around probably needing different level of training for those in cabinet and shadow cabinet, and then the leadership. I mean, I was lucky enough to attend the Perinthus exercise last year, and I'd attended, probably going back to when 18 months ago, maybe 2 years ago, a desktop emergency planning exercise, which was absolutely invaluable to me. But you know, I think that's something that all shadow cabinet and leaders should be undertaking.
Thank you, Cathy. Are there any more councillors wish to speak? I see 3 hands up, but I think they're hands that haven't been taken down yet. So. Ellen, can you see any more?
No, Chair, I agree with you. They're just people that have previously spoke.
We'll bring this one to a close then, because we're on course to finish at 9 o'clock. So Right, first of all, can I say on behalf of the committee and really on behalf of the people of this borough, thank you so much to the emergency planning team and everybody that worked tirelessly on our behalf to make our lives better during this pandemic, because what you don't see is the little feet paddling away under the water. And I know Barry and his staff and everybody else involved has been working their little socks off. So thank you very much for that. We now come to the recommendations, and I'll read them from the minutes. It's recommended that the Scrutiny Committee, 1, notes the role of emergency planning in the council, including the preparedness and response of the COVID-19 pandemic. Is that agreed?
Aye.
Yeah. 2, it notes the outcomes of exercise Perinthus and how the learning from the exercise was instrumental in informing the borough's response to the COVID-19 pandemic.
Aye.
Aye. Yeah.
Thank you. And the final one, and I've added something into this, it recommends the approaches to improve engagement with the elected members and maximising their input in managing future outbreaks and major incidents, including the possibility of mandatory and refresher training and advanced training for lead councillors,
Aye.
for cabinet and shadow cabinet.
Aye.
Is that agreed?
Aye.
Thank you very much. That brings to a close the first part of the night. We'll now move on to COVID-19, the procurement of personal protective equipment, PPE, pages 16 to 27. Who's presenting this? Are you presenting this one again, Kevin, or is it Rose?
No, Chair, it's Rose. Rose has joined us.
Rose Younger, thank you. Thank you, Rose. Are you ready?
Ready as I'll ever be.
Thank you. Go for it.
So I'm not going to read the whole report to you. That would not be helpful, but I just think an overview. And I should say, this is my personal view from leading the procurement team. And I decided that it was important to actually have a whole system approach, because clearly it's not just about procurement, it's about specifications, it's about ordering, modelling numbers, warehousing, distribution, stock control, so invoicing in some cases. So it's a whole system approach. And in my youth, I used to run an import distribution business, so this was a bit like returning to my youth. But I would start by saying that this was so much more than procurement, and Barry's on this call. And I well recall that poor Barry was incessantly called by my procurement team to check and double check the specifications of the masks and the equipment that we were buying. So, and I know that we were a significant drain on his time and his expertise. So this report reflects a huge collaboration of effort across services. And also officers without request offering to work at weekends, come into the council house to dish out PPE to help people out, troubled care homes and dom care agencies and so on. So it was a real collaborative effort. And I think I've heard the word proud mentioned a couple of times. I'm really proud of what that collaboration achieved. The price of PPE rose exponentially in the early days, and I've heard care homes saying that the prices went up by 1,000%. I mean, it was a massive increase in demand on the supply chain and a massive increase in price. And it also became a bit of a dog-eat-dog situation in terms of stock. And I'm also given to understand by some national suppliers that Chinese manufacturers were routing stock as slowly as possible, so that they could change where things were being delivered to higher paying customers. So there was significant issues in obtaining stock in the early days. the national flu pandemic stocks were slow to arrive. I think we rarely knew what we were going to get until maybe an hour or so before. We'd get a phone call to say it was arriving at the NEC. Rarely knew how much we were getting. So it felt really disjointed, and it felt a bit messy in the early days. Obviously, it improved significantly over time. In the early days, we were just buying, fairly basically, it was gloves, masks, hand aprons, the basics. But clearly, every NHS care homes were buying, big chains of care homes were buying stock, and every council was buying stock. And the West Midlands Heads of Procurement Group set up a Teams group, much as this was an informal collaboration group, and worked together collaboratively to get everybody's quantities and collaboratively procure, import, pay for air freight where we needed to get things in. So that particular collaboration worked, I have to say, extremely well. I think we did less work and got more benefit out of it than some others. I think some of the councils, particularly Wolverhampton and Walsall, who were doing the aprons and masks and gloves, were working very, very hard on behalf of West Midlands councils. There's a view that we didn't use local suppliers. We did where we could. We put out an advert on the Black Country Business Portal seeking local suppliers of PPE, and indeed we used a number of local suppliers to provide stock. We were fortunate to receive, when we couldn't get any masks. We were fortunate to receive some stocks from the CCG, and who then linked us up with one of our own companies so that we could buy direct. So we're indebted also to the CCG for their support on that. I've written recommendations within the report, and I will admit at this point some of them are outside the scope probably of the council, and some probably I've overstepped the mark a bit, but I felt it important to be honest and reflect where I think we could improve things for the future. I've thought about, as the fact that the CCG's bit of the report in here, that they were doing exactly the same things that we were, and so a question to myself is, would it have helped if we'd have worked cross-sector to procure PPE, or would that have delayed things because we've got different procurement rules and so on? So I think it's something perhaps to consider for the future, Chair. Or ideally review before there's a second pandemic or surge. The due diligence, we were approached by so many suppliers, and I have to say I probably still get 10 or 20 a day at the minute of suppliers offering me PPE, and what we discovered fairly on, local government procurement, we need to undertake due diligence on suppliers, and we do it in a number of ways. One is on the actual supplier, two is on the products. And with masks and so on, the certificates, for some reason, we had to check certification with an office in Hong Kong. I'm assuming that's where these things are certificated. But a lot of the stock that was being offered was found to not comply with the specifications that it claimed to be meeting. We did not buy any stock that did not meet the correct standards. Again, Barry and his public health team were really helpful in making sure that we had the right specifications and we were buying the right equipment. In the early stages, I think we're probably over modelling the demand and requirement. And that's because I think we felt we were having to supply the whole of the market, but the guidance was that companies should be buying from their normal supply chains. which clearly were also suffering with the same problems that we were supplying. So we probably over-ordered in the early stages, which proved to not be a bad thing, because we've now got good stock levels. And I think the guidance and as the events unfolded and will continue to unfold, the circumstances and guidance changed and will continue to change. Particularly, I mean, we've seen the guidance regarding masks change and therefore the demand increasing. We have so far spent 1 million and we have committed another 1 million to ongoing supplies of PPE. And of course, this pandemic is not going to go away anytime soon, so PPE will continue to be required. So we're keeping an eye on demand levels, usage, and making sure that we've got sufficient stock. And the West Midlands Heads of Procurement Group continues to collaborate. Barry mentioned internal supplies to staff and guidance to staff. I mean, clearly at the beginning of this pandemic, fear was rife, and I went into Dudley Council Plus shortly before the shutdown, and I was struck by the absolute fear in officers who were sitting with no protection whatsoever other than gloves. I don't think we even had masks at the very beginning. Corporate landlord helped out massively, put in screens, we got PPE to them, but I think fear drove staff to be demanding PPE or to be asking for PPE. Barry and his team helped us produce guidance to reassure people and tell people when it was appropriate to use PPE and when not. So we managed an internal ordering system with chief officers, directors giving approval to stop an over or to panic buying, internal panic buying of PPE, if you like. One of the things I was concerned about was the LRF stocks, which were the stocks that we were getting nationally, is whether all of those companies who were entitled to get to access the LRF stocks actually knew they were able to access it, and I don't have an answer to that, but I think the guidance on that could be improved and made clear. Probably not my call, obviously, because it's national communications, but I think it did cause some confusion in the early days. You know, we in procurement, we stopped all of our normal procurement. We supported the voluntary sector, the food bank, DCVS with PPE to enable them to go out to visit people and deliver food. I should mention at this point, our library and providers, GLL, when they were closed, their staff were delivering food, using the GLL vans and delivering food to people in Dudley. So some of our suppliers also joined the efforts. I'm going to just go on to item 23, paragraph 23, because I think that one got picked up in the press. At no time did we lose out financially to fraudulent suppliers. We're very careful with our due diligence. We were very careful with making sure that we didn't pay for PPE before we got it. We did use some P cards for some emergency stocks, but we knew that we were getting the stocks. We had one occasion, I know we ordered some body bags. They were due for delivery on a Monday. They didn't arrive ever, despite chasing, but we hadn't paid for them. So just so members are clear that whilst there were efforts to fraudulently obtain money from the council, it didn't succeed. The warehousing and distribution. Those of you who know where my office is in Council House, my office and the procurement office were turned overnight into warehousing for PPE, manned by corporate landlord and colleagues from procurement and the commercial team. as the stocks grew and the demand grew, that clearly became untenable, hand loading things into offices. And we looked at a number of options, and the community equipment service clearly have already got stock control system, stock management systems, distribution vans, and they also obviously have very good relationships with the care market. So they were chosen to help us distribute stocks right across internally and externally. I put under here that it reviews the key skills, because I think that, you know, I've run a warehouse system, and I know we've got a warehouse and distribution system in the community equipment services, but this involved, you know, air freighting, specifications. There was something for me about the skills in warehousing, distribution, logistics, which it might be useful for us to review for future pandemics, to make sure that we've got access to those skills if we don't have them in-house. Clearly, we're buying many more different, the range of PPE has grown significantly. It was, I think, just masks, aprons and gloves, and it's now sanitizer bottles of all sorts of different sizes, 5 and 10 litre refills. We're also providing wipes, sanitising stations to help make buildings COVID secure. And I've put in a list of the current list of PPE that's being provided. I'm going to move on to schools, because I think that's probably a very current subject matter. So when schools were in lockdown, and there was clearly concern with schools about reopening and about PPE, and actually the guidance was that schools didn't need PPE unless there was evidence of somebody with symptoms. And what the commercial team did in conjunction with colleagues in education was develop what we called a care package of PPE that went to every single school in Dudley, with masks, gloves, and some hand sanitizer. And that went down, that was very well received by schools. We looked at selling PPE. I know one Midlands council's, I think, selling PPE, but the prices that we bought PPE at were so high at the beginning of the pandemic that we decided that it was the small amount of money we might make for the council was probably counterproductive in terms of PR, that we might be seen to be profiteering. I'm not going to go on any further, but I'm truly grateful to the procurement team, corporate landlord, public health, commissioning, the staff in adult social care and the community equipment service, and there's probably loads of others that I haven't mentioned, because they absolutely bailed us out on PPE. That group of people, that collaboration was outstanding. And I'll leave it there, I think, and offer to answer any questions that you and your colleagues may have.
Thank you, Rose. Kevin, did you want to come in to add to that, please?
Yes, thank you, Chair. And with merciful brevity, which will be unusual for me, it's just to say that Rose has, I suppose, rather underplayed her own personal role in this by thanking a huge number of staff that work with her. What many may not know is that Rose is not a native of Dudley. She's here sort of 5 days a week, but then repairs to her family home in the southeast. Rose is actually leaving us to take up a new role very close to her home in the southeast a week tomorrow, and it would be remiss of me not to pay tribute to her and her efforts, certainly during my tenure and before, for the way in which she's approached her role generally, but more specifically with the way in which she's approached her role during the pandemic. We have never run out of PPE. We hear horror stories elsewhere in the country of those that have, and it's in no small part to Rose's leadership that we're in the happy position that we were in throughout the pandemic crisis, and currently the position we're in going forward.
Thank you.
Thank you, Kevin. I've got Councillor Cathy Bake. Now, I see Anne Millwood is waving at me again. So, Kathy Baton, can I take you next, please?
Thanks, Dave. And thanks, Rose, for, I have to say, a really thorough and honest report and some excellent recommendations contained within it. And good luck for your new job in the future. But can I just take us back to the so page 16 of the report, where you give the background to it. And you'd said that the DPH at the time had said that the response would be any PPE requirements would be provided by the national flu pandemic stocks. So no action was taken to procure anything. How quickly did you realise, or how quickly did the council realise that the national stocks were not going to come through? So we had, obviously lockdown came on the 23rd of March. We started to have cases in the borough the first case was quite early in March. When did it become apparent that PPE and the acquisition of PPE was going to become a major problem for us? If you could answer that, and then I've got another point, if you don't mind.
Yeah, I'm very quickly, actually, Councillor Baton. If you want me to get the date, I'll have to give you the exact date. I'll have to go back through my emails and get back to you. But it was very early on in March when we started to look at it, and we started working with Barry to establish what we needed. So it was very early. It was actually quite early on, and I should also say that I think that the answer that I got from then Director of Public Health was actually the message that was coming from Public Health England. So I'm please don't assume that I'm criticising anybody. I think that was the national message.
Yeah, absolutely. I wasn't suggesting that there was any criticism attached to the DPH. I think it was trying to understand the national messaging line versus the lack of delivery from the national message. And it's understanding that time lag and then the position that left us in.
Yeah, I mean, I think Kevin made the point we never ran out of PPE, and that's largely thanks to colleagues in commissioning who, were coming and collecting stock from Council House and keeping it with them so that they could actually also deliver during weekends. We also held some small emergency stocks over at harbour buildings because that's open 24 hours. So whilst I think we can honestly say we never ran out. We were rationing stocks in the early days and making sure that we ration stocks according to urgency. Colleagues in commissioning, and I think Matt Boucher and his team may be doing a presentation after this, but I know that commissioning colleagues were phoning care homes daily to establish their PPE requirements. So yes, we were rationing in the early days, and then once we started to get stock, in fact at one point we started to run out of warehousing space, so we did a really good job of getting it. But in the early days we were rationing, but we never actually ran out.
Yeah, if I can just come back then, thanks Rose. I mean, I am aware that obviously at that point in time I was Shadow Cabinet for Health and Adult Social Care, and I am aware that at times it became a bit hairy about the rationing and the provision, and that, you know, we were very grateful to the leader for the very firm letter he sent to local MPs asking them to pressurise the government about stocks and about getting it out to the front line and to the people who needed it. But it just struck me as you were presenting your report when you talked about the question mark around the benefit of cross-sector procurement within Dudley. And I had wondered at the time whether what the benefit would be of a cross-sector procurement arrangement between the council and health, and then, you know, rather than all of the care homes we had trying to procure their own stocks, that they would procure under these circumstances from one place, which would be the council stroke health, and whether or not that is a model that could take some exploration.
So, I mean, health and local authorities have slightly different procurement rules and probably approval process. So it could complicate things. But one of the things that we did do as the West Midlands heads of procurement was look to see whether we couldn't open up that collaborative procurement to care homes. Unfortunately, by the time we kind of dealt with the panic bit, which was in the early stages of getting understanding numbers, placing orders, finding suppliers, checking specifications, getting stocks in, by the time we started to have that conversation with care homes and care agencies, that their own supply chains had started to improve, so that as we sorted our demand problem out, their demand problem was also being sorted out, because there was clearly, I think, a 6 or 8 week lag for things to get from the Far East. But I do think it's worth us looking at, because what is absolutely clear is we were all looking for the same stuff largely. Surgical masks probably were more in demand in health. But we did get some stocks, but I think that there's certainly that's worth looking at for the future. Would seem to me to make absolute sense.
Thank you.
Thank you. I'm going to juggle the order a bit slightly. I've got Matt Bowsher wants to come in now, just to clarify a couple of points that have just been raised, and then I'm going to bring in a committee member, Councillor Jackie Cowell, and then Councillor Anne Millward, who's a guest, and then Barry Jones. So if you can hold yourselves ready then. Matt Bowsher, please.
Thank you, Chair. Could somebody just give me a thumbs up to confirm my audio is okay? Thanks, Rose. So just in terms of the key pinch points in terms of PPE supply, the week before Easter, the bank holiday weekend, and the week after Easter were probably the most constrained periods that we found throughout the pandemic. There were 3 factors that really got us through that time. Firstly, the supply of bulk deliveries through the LRF infrastructure. Secondly, there was some very, very important mutual aid within the borough across health and social care. So both the Mental Health Trust, the Dudley Group in terms of face visors and masks, and also Dudley CCG assisted the council at those points of key difficulty. And indeed, we reciprocated with our own stock when primary care stock began to dip off a little bit. The tightest we ever got, I believe, was a 2-day supply for care providers. Throughout the pandemic, we've maintained a rolling average of 5 days worth of stock. And as Rose indicated, when those supplies began to build, obviously we passed those through in a timely fashion. What was a challenge from the regional arrangements was the lack of clear communication and predictability of when those supplies were going to arrive, the quality of some of those supplies, and whether or not they were bypassed for other purposes, particularly when we had COVID in very high instances in the acute hospitals. I think the remit of the LRF, the regional group, originally was to work out the loaves and fishes exercise of how that stock was then passported back to local government and a range of other organisations. And Rose is quite right. If we were starting the exercise from scratch, you would weave in procurement expertise. But I think it's important not to lose sight of where we were at the time and the context that we faced. It was about getting urgent and essential supplies to the front line as quickly and as seamlessly as we could do. Thank you, Chair.
Thank you, Matt. Councillor Jackie Cowell, please.
Thanks, Chair, and thanks, Rose. I've got 3 fairly straightforward questions. So if I just ask I'll start off with the first one, and it goes back to a point that Kathy's referenced already, which is the background on page 16. I just wondered whether we got any information on what the assurance was in terms of what we would get and what sort of quantities. I know that it went wrong, but do we know what was in effect, what was promised and when it was supposed to arrive?
It may well be that Matt might be able to help with this, because I know he was on a national group. So in terms of quantities, my understanding is that it was based on numbers of residents in the borough. So there was some. I'm going to use the word algorithm, which probably might be the wrong word, but an algorithm that was used to calculate how much stock we would need, depending on the number of residents in the borough.
That's crudely.
If I can perhaps.
Yes, Kevin, go ahead.
Yeah, thank you, Chair. So in the early days of the pandemic, the chief execs, we were meeting every day, 7 days a week at 8 o'clock, in order to understand the evolving situation, and we're getting feed-in from the military, who were delivering the stock of PPE that was available. That was being delivered actually to the NEC, not far away from what then became the Birmingham Nightingale Hospital. And just to sort of finesse Rose's reply, the quantity of stock being delivered was being dealt with in a proportion, not just by way of the number of population per capita per borough, but also there's a weighting as far as age was concerned. And the age profile of Dudley is rather different to the age profile of perhaps our next nearest borough in Sandwell, which is a younger borough, if I can put it that way. And therefore our weighting was slightly higher. So it wasn't just by dint of our 320,000 population, it was also the age profile as well, which is a sort of as part, as Rose said, of the algorithm that divvied up, as it were, the stock was being delivered. And perhaps Matt can assist a bit further.
Thank you.
Yes, indeed, it was a very crude initial assumption about the proportion of population aged over 65. At that point in time, we needed something as a ready reckoner to divide the supplies up. Of course, that was never going to be an accurate denominator long term, because there are people, as you all know, Councillor Carroll, from birth who would need PPE to appropriately cater for their care needs, and indeed even in adult social care you've got people aged 18 upwards who needed to access PPE supplies. But that was the initial set of working assumptions. This in a wider context, that the LRF, the regional supplies, were only a proportion of the PPE that was available at the time, so it was never going to cater for total demand.
Thank you. Okay. The next question I was going to ask was around the location. I think you mentioned the community equipment stores, Rose. Is that something that we're going to carry on going forward, and is that sort of maintainable in that position, or are we looking to other arrangements?
So I have to defer that one to Matt Boucher, because obviously the community equipment store sits within his area. Clearly the arrangement has worked extremely well. Whether that's sustainable for the future, I'll have to leave that to Matt to answer, if that's okay, Matt.
Thank you.
Yeah, thanks, Rose. For the time being, it will remain at the Community Equipment Centre, because we've got the electronic stock management ordering system and a means by which that we can audit exactly what's gone where and when. As Rose indicated earlier, we now have quite a large physical volume of PPE, and we're going to need to turn the community equipment store into a palace in order to sustain that arrangement long term. So we will continue to revisit, particularly with care providers, their requirements now. Procurement chains have opened up and we're getting back to more towards business as usual. I suspect we will be looking at schools' requirements as we go forwards. We'll need to think about people returning to work and what that means. And also we need to bear in mind that as an organisation, we've benefited from a lot of businesses and a lot of community organisations contributing stock in. So, for instance, there was a point where dentist surgeries were pitching in. Thomas Dudley manufactured for us. We had a number of logistics firms that were sharing gloves with us. So obviously, when we get to a point where we've got absolute bare minimum of COVID, we'll work out what our ongoing business requirements are. We'll come to a sensible solution about stock and distribution. and where possible, we will seek to make sure that those organisations who help us have that help reciprocated, which is only right and proper.
Thank you. And the final point was around what we can see in the appendix in terms of the number of items. There does seem to be quite a lot of duplication, if you like, in terms of, I understand why there's various sizes of things, but there seem to be multiple product codes for what on the surface of it looks very similar. And I wondered whether that was just a function of what we'd literally been able to grab hold of in the climate, as it were, or whether we were looking to rationalise that perhaps going forward to benefit a bit more from economies of scale, perhaps with some more standardised sizing and taking the opportunity for things like refills on hand sanitizer and things like that.
So there is duplication, you're absolutely right, and what that's designed to do is separate the LRF stocks and the council procured stocks, because the LRF stocks are protected for certain groups of customer, whereas the procured stock is available to internal staff, etc. So that's the difference in part numbering is for that reason and for that reason only. As regards your comment about refills, I mean, we've now got large stocks of 5 and 10 litre bottles of hand sanitizer, and clearly that's one that's obvious for using for refills. So yes, we will probably reduce the number of different sizes, but again, in the early days, if we couldn't get, for example, a 5 litre, a half litre bottle of hand sanitizer, but we could get 1 litre, we just got whatever we needed to get, whatever size it was in, whatever colour it was. We just made sure we got enough stuff in to protect people. So you are right. There probably is some duplication, and as the stocks of things will run down. If you saw the stock list, some of those things have got 0 because we no longer buy that size now that the supply chains are back up and running.
Okay, that's great. Thank you very much. Thank you.
Thank you, Jackie.
Thanks,
I've got Councillor Anne Millwood, one of our guests. Come on, Anne.
Yeah. And thank you, Rose, for what I consider to be a very concise report. Your narrative, you know, it sets out clearly how we've overcome a major difficulty against a national problem, and of course, it tells the story in a truthful way. We've had some scurrilous reporting in the press. We've had some real scaremongering, and I'm very sorry to say, Chair, but we've had some political posturing which has been of no use whatsoever, as we should all be pulling together in a pandemic that we've never faced before. So I'd like to thank you, Rose, for that very concise narrative. You know, it's been very difficult nationally. We've rose to the challenge, but I would like to sort of echo what Kathy says and what you yourself say in the report about let's work together with, you know, with our colleagues across health, whatever, to look at procurement in that way. I was also going to ask a question about warehousing, but I think Matt's answered that, and I think that's a good idea to keep it within the community equipment hub. But I would like to thank you, and I'd like to thank you and all the staff for everything you've done, and very good luck. All the best wishes in your new job. We'll miss you. We really will.
I'll miss Dudley actually as well. Thank you.
Thank you.
Thank you. Barry Jones, you want to come in, Barry?
Yeah, thanks, Chair. Much of what I was going to say has been covered actually, but it was just that I think in the early days it was a bit like the Wild West, and it was about people jumping in cars, driving round and picking up equipment, people calling us left, right and centre, running out of supplies. But what I can say, and even Matt's covered this, even if it was 2-day supply, nobody who called us was left without any supply. And if we didn't have it, this goes back to our partnership arrangement again. We called up Dudley Group, who were stretched themselves, and they gave it us to make sure individuals in their homes, people in the hospice provider at Mary Stevens had supplies. So I know they're not on the call, but I think it's important just to recognise that, again, we pulled together to get this sorted, to make sure we protected our residents, and even that was there were tears and laughter between myself and Rose at many times during this pandemic. But it was, I think it's just important to say that it really was a system effort on this.
Yeah.
Thank you, Barry. Councillor Steve Waltho.
Thank you, Chair. Just very quickly, because I am very aware of the time and people's time this evening. Thanks for Rose for being so kind of open and absolutely honest across the piece about the situation. And I think it comes back to Kathy's comment earlier as well, that perhaps next time we ought to be now looking for a more cross-borough collaborative approach to PPE and not outside of the borough. Because I was actually, my experience was a little bit on the front line sort of thing. I was volunteering at the Dudley Group of Hospitals because their volunteer force had gone so small that they were asking other people to help. And I was delivering PPE from people's houses, and that amazed me. So many good volunteers across the borough were manufacturing this stuff. I presume it was to a decent standard because I was taking it to several care homes in one run on an afternoon. So, yep, fully echo what's been said about the PPE and the situation. And we do need to work across the borough because I think there is a lot of potential there for a big collaborative approach. But hats off to the officers again for what they've done in coordinating the efforts. Thank you.
Thank you, Steve. Any other councillors on the committee wish to add anything? Alan, can you see anything?
Councillor Miller, Chair.
Yes, Councillor Peter Miller.
Okay, thank you, Chair. Very good, Rose, what you've said. You've done marvellous, actually. What I'm wondering is, what was the stocks like when we started? It's sort of early March. Had we got a normal stock, above stock, or below stock?
I think arguably we had low stocks, hence we were rationing in the early days. So I can't give you exact figures, but we were living hand to mouth. And as Matt said, we were using this system called mutual aid, where agencies were supporting each other. So I well recall getting a call from Samwell NHS Trust saying they'd run out of body bags, and we just said come and collect them at Council House. There was an awful lot of that going on in the early stages. So I think yes, we had low stocks to start with. We were buying from wherever we could, initially in fairly small volume because we were buying locally, but we I don't know if any of the members of this group remember something going in the press about body bags arriving at Dudley, and that was due to a delivery driver thinking he was being clever. Actually, that really helped me out because I was able to give the managing director of that distribution company a right royal roasting, and we became his #1 customer. And he said, "Whatever you need from me, Rose, you just call." And so, actually, bizarrely, that did me a real favour because we suddenly became a really important customer because he wanted to make sure we were happy. So, so there's bizarre things happening like that. But we were rationing to start with. Barry was helping us with that. I mean, I don't know how many hours a day Barry was working, but he was helping us ration stocks. Commissioning were helping to ration stocks. I mean, it was probably knife edge stuff at times, but I don't think anybody ran out. It might have got close, but I don't think anybody ran out.
Thank you, Rose.
Thank you.
Councillor Elaine Taylor.
Thank you. You can hear me. Thank you, Rose. You did really well. Page 23, you said recommendation for there is that a small working party is set to oversee plans for spike in COVID-19 or future pandemics to ensure that the council doesn't make the same mistakes. Is this actually this is a recommendation moving forward? Are you right at this point in time, if we had a spike, now the children have gone back to school, you were quite confident that we would have enough PPE to supply the whole of Dudley, the whole of our borough, so that we would be covered?
Absolutely.
Am I that right? Absolutely, yeah.
I'm absolutely confident. I mean, I think Matt alluded to it. We're actually running out of warehouse space. We've done a really, really good job of procuring PPE. We have, as I say, we're aware that, you know, schools may require PPE. So we are in regular contact with schools. Our Revolution, the commercial team are on daily the call. I don't think it's daily anymore, but they were daily on the call supporting children's services. And managing the communication with schools and the council. So our portal, trading portal's got a communication module. So we were using that to communicate with schools. Special schools, I should also add, were treated as care homes. So we provided whatever they asked for, basically. So schools where they had children with severe disabilities where PPE was needed, we treated those as a care home. So those schools were treated differently. Hand on heart, we're good on PPE. Clearly, if there's another spike and that increases, that situation may change. But right now, today, we're good.
And we're being cost effective and not letting our stock run out of date. We are, you know.
So our stock is, so the stocks that came centrally from were what's called over stickered. So some of the stocks, the masks had a date of November 2019, and when you peeled that sticker off, there was another date sticker underneath it. And I mean, Barry will probably know more about this, but those stocks then had to be quarantined and retested to make sure they still complied with the standards despite being out of date. Our own stocks, of course, have only just arrived since March, so our stocks are in date and good.
Right. Thank you.
Thank you, Elaine. I've got Kevin O'Keefe and Barry Jones. I've still got your hand up.
Mine isn't. I think the phrase now, Chair, that we're used to doing MS Teams, it's not a legacy hand. I didn't forget to put it down. I've re-raised my hand. There's just one issue I think that hasn't yet been highlighted in the debate tonight, and that's around the sufficiency, the appropriateness, and the requirement for appropriate PPE. And that's an education piece, really, that Barry and Rose led on, which I think can't really be understated, because you know, if one was being completely over the top, you might think that, you know, an astronaut's suit with an external oxygen supply would be appropriate PPE for your work setting. But of course, on a proper evaluation and clinical analysis of the work setting, actually perhaps just a face mask and some rubber gloves might be the appropriate PPE. So as part of the way of rationing PPE, it was also there was a major piece of communications about ensuring that people understood what PPE they actually needed for their roles, rather than over providing and overcompensating for anxieties and, you know, entirely natural apprehensions in the work setting. But I think that's a really important piece that may not have been drawn out so far in the discussion tonight. Thank you, Chair.
Thank you, Kevin. Barry Jones, you want to come in again?
Yes, Chair. It was a legacy hand, but actually now there's something else been mentioned. Yeah, I think the key for us actually was we had to keep the show on the road, and Rose hit the nail on the head at the very beginning. If you think of the national messaging and everything that's been said, our staff were in real fear of what they would face. So a lot of what went on behind the scenes, as well as getting the PPE, and that was to our care homes, to domiciliary carers, etc., was to make sure they knew how to use it and the appropriate level. And a lot of what we did behind the scenes was working with those staff and having regular touching bases with our home care staff, because they were the front line during this, and we needed to make sure they felt the confidence to go into people's homes who may have COVID and care for those individuals. And we worked really close with those services to make sure they had the PPE, they knew how to use it and what it meant as well. So that was the other bit as well, really. I'll shut up after this, honestly. Thanks, Chair.
Thank you, Barry. Are there any other councillors from the committee who wish to make any points?
I can't see anybody, Chair.
Thank you, Helen. All right. Rose, thank you so much. I mean, when I read your report, I think how forthright it was and how refreshing to see somebody put a report in that actually meant, it came from the heart. I know it did, because actually, when you look at what we want to do on this committee here, we want to make life better if phase 2 comes along, if the second wave comes along. We can only do that if we're honest with ourselves and we make improvements over the first wave. And your report is going to help us to do that. So that's a heartfelt thank you from me, and I know all the members on the committee and everybody else involved. You've thrown us a little bit because you've given us 2 recommendations to start with. I'll just read these for the members of the committee. It's recommended that scrutiny note the contents of the report and consider the recommendations contained within the document. That's the first one. The second one, that the exceptional work undertaken by the procurement team, corporate landlord, commercial, public health and safety officers during the pandemic be acknowledged. Well, that's a given, because we do acknowledge everything they do. Now, the 9 additional recommendations you've given us, I would like to roll those up into the recommendations that we put forward from this committee. If the committee agrees, I'm happy to do that. Some of them may be a little bit off-piste, but it doesn't really matter, because this document will eventually finish up at a higher level, hopefully at the LGA, or maybe even go to government. But a lot of the documentation will stay local, and we'll work on the recommendations that you put forward. But some of the recommendations need to move on to a higher plane, so thank you for those. Does the committee agree that I can roll those recommendations up into one?
Yes, Chair.
Yes. Thank you very much, everyone. Thank you, Rose, and all the best for the future and good health.
Thank you, Chair, and yeah, thank you for the opportunity to work for Dudley. And I'm glad I was slightly concerned by the way the press reacted to my report. And perhaps what I should have done is, instead of referring to recommendations within the report, perhaps I should have called them suggestions.
No, the recommendations now. Too late. Thank you, everyone. Thank you, Rose. We now move on to Council and Partners' response to COVID-19 pandemic communications. Kevin, are you presenting this?
I'm not presenting, Chair, but Phil will present with your leave. I'd just like to again give a few words in preface to this. Okay. So in terms of communication, I suppose the key thing is effective communication. And there are many definitions of what effective communication may be, but my preferred definition is a simple definition that describes something which is far from simple. So the simple definition of effective communication is it's nothing but the presentation of the views of the sender in a manner that is best understood by the receiver. Now, it's simple, really, isn't it? But of course, it's far from simple. It's far from simple. And what our comms team have done, and it's a bit like, and my order's on the line, and Bal is usually on the line when I speak. And whenever I speak about anything to do with public health, I then, as Phil and the members of SEB will know, I always then ask them at the end to mark my homework to make sure I've not overstated something, understated something, or misstated something. But in terms of public health, it's not about curative health. It's not about, going to your GP because you've got a sty on the eye or a sore throat or whatever. A lot of what public health do is about communication and about education in real time. And if we look at the statistics, we've seen, it's been alluded to by members and officers during the course of tonight's presentation, that per 100,000 of population, Dudley's infection rate has been around 6.4, 6.5, 6.8. Today, 6.8 per 100,000. Our next nearest borough, on my last figures, are 27.8. And at some stages, within the conurbation of the West Midlands, it's been 32 per 100,000. But Dudley's has always stayed around 6, 6.4, 6.5, 6.8. And that's getting home the key messages, right at the very beginning, that the mantra of wash your hands, stay at home, protect the NHS, and that's matured into the multi-channel multi-audience approach that comms have led on. We have an excellent comms team, and I'll say that very firmly, and I'd like that to be admitted. We have an excellent comms team, and the role that CAPA do in hand with the other services in this instance with public health creates that atmosphere, creates that environment which engenders safety, which engenders changes in behaviour in the population. And again, it's the sort of thing that's been replicated by our councillors and our MPs, replicating those key messages and being the signposters within the community and the voices of the community that report back to us, so we develop that dialogue. When I was a young solicitor being trained, my then senior partner said to me one thing that stuck with me the rest of my professional life, and that is that excellence never occurs by accident. I'm looking at our figures today of 6.8 infections per 100,000 compared to some of our neighbours in the 20s. Chair, excellence does not occur by accident. And on that point, I'd like to hand over to Phil.
Thank you, Kevin. Phil, over to you.
Yeah,
Please.
many thanks for that, Kevin, for the introduction, and thanks, Chair. As with the other reports, I trust that all members have had the opportunity to read the report and also the supporting documents. So I don't intend to go through it line by line, you'll be pleased to know, because I'm also mindful of the time. However, just to provide an overview, as with Rosie's report, to hopefully help members to be in a better position to provide feedback and hopefully some possible areas for improvement as well. I'll just spend the next few minutes just going over some key pertinent points, if that's okay. I think it goes without saying that coronavirus has presented local government as a whole with one of its biggest challenges in a generation. And I think Barry, in his report earlier, made it quite clear how important communications has been with that. And I think that's absolutely right. I think one of the primary challenges during the whole pandemic period over the last 6 months has been around addressing the uncertainty and anxiety inevitably within people across the borough, and for us to basically make them feel as well informed as possible through that time. I think paragraph 3.2 of the report explains how the senior leadership team at the council has worked to a COVID-19 8-point plan, and point 8 of that plan specifically refers to communications as a key action that needs to be delivered across the previous 6 months, and obviously it's still ongoing, and we know that across the next coming months and time ahead as well. We've worked against that plan to deliver communications, to deliver key messages to a variety of audiences that I'll outline in a short while via a mix of communication channels. The professional corporate comms channels that we utilise in CAPA through the team are, of course, an essential part of the communications mix, but I do think it's important that the committee recognises the important role as well of all council staff, of all managers, and indeed of yourselves across. I think Kevin's just alluded to it, and I think the importance of sharing messages through all of our networks is so important in getting this communications through to our communities in times like this. And I think paragraphs 3.5 and 3.6 of the report cover that. And I think that ethos as well should be applied when we think about partnership communications. I think the importance, again, of all directorates at the authority working together to communicate with partner organisations that they are dealing with on a day-to-day basis is key. And I think Councillor Wolfow's reference earlier around the importance of partners being part of this scrutiny process is very valid indeed. And I know that for the next scrutiny committee scheduled for October, there'll be a specific focus around partnership where we can look into more detail at that. So back in terms of the key sort of corporate communication channels that we've used as a communications team, I think given the sheer scale and quantity of work throughout this period, it's been absolutely vital that the comms have been slick and responsive and prioritised against the emerging priorities of Strategic Executive Board. I think SEB's role has been there, but inevitably the priorities of SCB have changed day to day. At times in the early stages, let's be honest, it was hour to hour as things were unfolding. So it's been important that comms have been there, ready to respond and get communications out across the whole of the week, 24/7. Goes without saying, I think it's a common theme tonight. I'm incredibly proud of the expertise and professionalism shown by the entire communications team throughout the whole process. And unfortunately, it's impossible to showcase the sort of huge variety of communications and the work undertaken by the team. But I would urge members to take a look at Appendix C to today's report, which is a COVID-19 communications summary, which tries to give a flavour and an overview of the variety of communications that we've delivered. The document looks to break down the key audiences. This is looking at all borough residents as obviously a key audience, all borough businesses, but then right the way through to more targeted communication for our most vulnerable and elderly, to our children and families, as well as our own council staff, and of course yourselves as elected members.
Hello?
Hello?
Yeah. It was 20 past 8. What is it? Because I'm still at this meeting. Tell me what it is so that I can write it down.
Hang on, Phil. Elaine, have you got visitors, Elaine? Carry on, Phil.
I'll carry on. The summary highlights the important. I'll see if I can share this with you, actually, Chair. I don't know if you can see that. Are you able to see that, Chair?
Yes, thank you.
Yeah. The report highlights the important role of the local media in supporting messaging. Obviously, media relations so important, and I think the local, regional and national media have obviously covered coronavirus extensively, and it has supported us with local messaging and important public information. As well as the media, it also covers much of our work in terms of some of our key channels, including our digital channels such as the e-bulletins and social media channels that we've exploited to maximum effect over the last 6 months, as well as more traditional methods of communication, including, of course, the Borough magazine, which is we've had 3 editions issued over the last few months, all to Borough residents across Dudley. Communications around coronavirus is still very much ongoing, of course, but we're working to evaluate our performance as a council, and appendices A and B do attempt to provide the results of 2 recent resident surveys. It is early days, it's the initial results that have come through, but at least it gives a flavour and a feel for those outcomes. As I say, we're still very much within the pandemic period, but we're looking to evaluate as we go along. In addition to the feedback in appendices A and B, the comms summary that I've currently got up on the screen, Appendix C, also features plenty of metrics and data to show the effectiveness of communications in relation to its audience and its audience reach as to how many people we're able to get various messages through to at different points. In terms of back to referring to the main report, I think as we've heard tonight in previous reports, there's been a tremendous amount of work that's gone in across the whole authority, and it really has been a system-wide, council-wide approach. And I wouldn't start to claim that communications has been a sole factor in relation to the R rate, but as Kevin alluded to in Dudley, thankfully, due to hard work of council workers, of partners across the borough, and indeed residents complying with difficult measures at times, the R rate in Dudley has remained low, and I would like to think that the communications has been at least a significant contributing factor towards that. But we know it doesn't stop there. The public health COVID-19 comms group is well established and will continue to meet moving forward over the coming months to ensure that our communications continue to be well coordinated and on message. Jumping ahead in the report towards the end, as I look to wrap up, paragraphs 4.5.20, you'll see that the Dudley Local Outbreak Control Plan is highlighted there. This is now a key area of focus for us as we look to take measures to prevent an outbreak in Dudley. And where possible, obviously communications and engagement is absolutely key to this. Where possible, we'll prevent that outbreak, but also ensure that planning is in place, that communications messages are ready to be rolled out in any target areas should an outbreak occur. And finally, I think in terms of other ongoing work that's referenced in the report, the community engagement led by public health colleagues will be real key now over the coming 6 months or so. which will also include the introduction of the COVID community champions to help share information with communities. I know that elected members will be vital in the work, and a members toolkit has also been developed to ensure that members have clarity around their role moving forward. I believe this actually went through a cross-party member-led engagement board only this week, so I think that member toolkit will be uploaded to the members portal to support members with messaging and how they can help to share and cascade communications through their networks moving forward. Without any further ado, Chair, I think I'll pass back over to you and welcome any comments from members of the committee. Thank you very much.
Thank you, Phil. Are you going to take your presentation down, Phil?
Yeah, will do.
Okay, so. Thank you. Councillor Cathy Baden, your hand is up.
Thanks, Chair, and thanks for the presentation, Phil. I think for me, the communications as a golden thread is absolutely critical, and that's our own internal communications between staff and the leadership, between elected members, and then external facing communications of partners externally into the combined authority areas and also to our residents. Couple of questions really. One, we have certainly noticed that there is a deficit of compliance with COVID precautions amongst some members of the community, particularly in the town centres, and just want to press you a little bit further on what the communications approach is going to be to that, or how your communications approach can support other aspects of work within the council being done in that area. And also, you commented about the 3 home deliveries that have been done, which are great and very needed. Would you, I think my only comment on that is that actually I think we were perhaps a little bit slow off the mark for the first one. Now maybe that was because there was just so much information being thrown at us. It was very difficult to get it out and get it to press. I realise that it's a huge job, but yeah, just those 2 points really.
Thank you, Cathy. Phil.
Thanks, Councillor. I'll pick up the second question first, if that's okay, while it's fresh in the mind. I think that with the Home magazine, I think you're right. I think traditional printed press is difficult because there's a time lag between production and it going off to print and then distribution. I think in terms of the first edition, we did get it out as quickly as it was actually physically possible. I think we were straight away immediately looking at the initial government messaging to get a correspondence out to all borough residents as quickly as we could. We use Royal Mail for our distribution, which is the most reliable source, through the postman, as it were. There is a 2-week lag within that process itself. So you can imagine with another week's preparation of putting content together through the graphic design team and then to print before it goes to distribution. Unfortunately, it is horses for courses and just par for the course, really. I think in terms of 3 to 4 weeks is a realistic time to get. I was about to say 32 page. I think with that initial one, we did it as a shortened version, didn't we? 16-page edition that went out, printed to well, it was certainly all 135,000 houses. I think the print run was larger than that. Yeah, it is a big job, so it did take slightly longer. Fully accept that, and that's why I guess the digital channels that we also use, it's very important that we use that mix. But I appreciate some audience members and harder to reach groups may not be those that are able to access the digital content as well. So it's really important to get it through the door. In terms of your other question, deficit of compliance, if I understand the question correctly, in terms of just effectively members of the public who are failing to follow guidelines, I mean, it's difficult to say. Obviously, we can only look at the facts and figures that we've got in front of us. That Dudley's rates are in a good place, that our compliance is good on the whole, and I would argue probably as good or better than most places. Equally, any failure to comply is something that we need to address. I know that within the sort of partnership working with Sally Borner, who I know has has retired, but with police colleagues looking to monitor those situations throughout the whole of the pandemic period, when we've had various social distancing concerns within towns as they reopened, within our parks at Himley when it was very busy. And it is very difficult in terms of communications. I think what we've put in place is physical signage up in the towns, and we will continue to amplify all of the messages from national government as well as local messaging to try to hammer that message home. But it is a challenge.
Yeah, thanks. I think I think what I would like to encourage the council to be considering is actually some additional face-to-face engagement with people in our town centres. You're quite right that Dudley's R rate is low, and that's how we want to keep it. And we want it to be the lowest in the region for all the obvious reasons. But I think we have to really make sure that we work with some of our very hard to reach communities in a way that is effective. So I'd just like to encourage that.
Yeah, through you, Chair. I think you're absolutely right, and that's prompted me actually on to, and it is public health colleagues who will know the detail of this better than I, but the COVID community champions that we are looking to launch, which is referenced in the report, which is part of that ongoing engagement process. Hopefully we'll start to get that through the community so that we can start to get more face-to-face engagement with people so that we can tackle the issues head on, as you suggest.
Thank you, Phil. I've got councillors Chris Neal and then Councillor Jackie Carroll.
Yeah, Chair, Kathy's just asked one of my questions, so I'm all good, thank you.
Thank you, Chris. Jackie Carroll.
Thanks, Chair. Just a couple of comments, really, or queries. In the report, Phil, under 4.5.8, around BAME communities, there's this talk of a programme of Friday focus webinars. I just wondered whether Friday maybe this is me thinking a bit too far outside the box, but whether Friday perhaps isn't necessarily the best day for some groups. Like, for instance, the Muslim community I know it's quite a significant day for them. And I wondered whether perhaps a different day might have got slightly better engagement, for instance. That's just perhaps a bit of a wacky thought. And the only other point really I was thinking about was in terms of printed materials. I know there's been some stuff done in several languages, but I wondered whether perhaps for those most hard to reach, where they speak perhaps unusual dialects, or perhaps don't read very well at all, maybe we could look at more of an infographic type principle, and whether that might work on some of the signage or some of the leafleting. Just kind of chucking that in, really. I don't know what you think about that.
No, thanks, Councillor. In terms of the first point in relation to the BAME sessions, I know that they actually came about and were instigated by the community themselves who approached us. I don't have the close knowledge on it to know why it was Friday evenings that were chosen for the sessions. May have come from the community, but I'm happy to feed that back in, and if there are further sessions, obviously that can be reviewed, and whether Friday was chosen for a positive reason, but I will reflect your views back to them to see if there's a more suitable day if that was the case. But I think we were generally quite pleased with the response rate in terms of the numbers that got in touch and the numbers that attended the webinar sessions on the Fridays.
Okay.
In terms of the second one, again, really valid point. Happy to look forward. We do look to be as creative as possible with all of our communications, and infographics, as you've seen on the appendix that I've shown you, is one method of simplifying messages to make it nice and clear for various audience groups. And you're right, in terms of those harder to reach groups and certainly those where English isn't the first language, it's obviously absolutely essential that we modify the communications. As you alluded to, we've done alternative formats of most of our materials that we've produced, the home magazines and other materials that have gone out around key messages, to ensure that whether it's large print and audio versions for visually impaired, right the way through to translating into 9 different community languages as well. But totally pick up your point as well on that moving forward. We'll have a look at that, no problem. Thank you.
Thanks, Phil. Thanks, Chair.
Yeah, Phil, is this where the COVID champions might come in more useful with the hard to reach communities?
Absolutely. I think, as I mentioned with Councillor Baton's comment there, I think the COVID champions, as I say, I don't want to speak out of turn. I can see that Mayada's got her hand up and she may be referencing that as a public health colleague with the engagement team there. But certainly I think the engagement work over the next 6 months will be key to much of this.
Thanks, Phil. Mayada?
Thank you, Chair. I just wanted to comment on the community engagement and BAME engagement. The sessions were really successful, and they were planned into COVID in the first one, and then addressing comorbidities which affect COVID, like obesity and lifestyle factors, and diseases like chronic diseases, and was presented by consultants from Dudley and from outside the borough as well. So the engagement were really very well between the community and presenters, and we are in the process of finalizing the final evaluation as well. So in terms of further engagement, we do have our community development team and community development workers, and they are doing a lot with hard to reach communities in terms of engagement and in terms of translation and in terms of exploring the need of those communities. And one of the plan is the Director of Public Health, if I may say that on her behalf, is planning to meet with community leaders in a series of meetings to address or to ask or to plan further and to finalize the future engagement with communities based on what the leaders think. Thank you.
Thank you, Mayada. Nothing to add on that, Phil?
No, I don't think so, Chair.
Okay, thank you. Jane Emery, please.
Hi, yes, thank you. I suppose I'm just really endorsing the further community engagement and, would be there from a health watch perspective about involving the communities. So it's just about those champions and that role and linking in with existing groups that already are around. So the Information Champion Network, the Young Health Champions, all the volunteers through Dudley CVS that provided the support around the shopping and meds collections. They were people that had never volunteered before, but there's 200-300 odd people that were kind of connected. Some of those back at work now, but others that want to continue. So it's about just making sure that we connect that kind of from a partnership perspective, to make sure that we utilise as many people as we've got in the communities that want to continue to support us really with those messages.
Thank you. Phil, anything? I've got a feeling you'll be ringing Jane.
No, absolutely. Again, I think it's a case of, I know we've got people on the call this evening from Public Health, Jodie Pritchard and her team around community engagement. We'll work as CAPA very closely with Public Health to do that over the coming time with colleagues like Jane.
Thank you. I got Joanna Pritchard next, please.
Hi everybody. Yeah, I think Mayada, Phil and Jane have pretty much covered what I was going to say really, but just to reiterate, the community development workers have been in close contact with many of our BAME communities throughout the pandemic, right from the beginning, in terms of keeping in touch with them through phone calls and emails, and have been very successful in getting messages out to those communities through word of mouth. But also providing them with information in a timely manner, so they've been able to share it through their networks in the format that suits those communities best. And for many of them, we've been finding that they prefer to use things like WhatsApp and also their local Facebook pages. So we've really been supplying them with the messages and the guidance in a timely fashion for them to cascade onwards. And actually, in many cases, that's worked better than printing materials in many different languages, because again, there's a time lag with doing so. And often people don't really want information in that format anyway. So part of what we're doing is listening to those communities very closely as well, to make sure that we're responding to them in the way that they feel is best for their groups and their communities.
Thank you, Joanna. Phil, anything to add on that?
No, that's fine by me, Chair. We'll work with Jodie and the team.
Okay, thanks very much. We come towards the end. Ed, are there any other members of the committee who wish to add anything to the discussion? Helen?
No, Chair, I can't see anybody requesting to speak.
Thank you. I was just wondering in case someone's hiding. All right. Thanks very much, Phil, and thanks for all your work. And can you pass on our regards to your team as well?
I will do. Thanks very much, Chair.
It's been clear throughout tonight's proceedings that we've got some really committed and professional staff at every level on this county. Every single one of them stepped up to the mark. And considering a lot have been working from home as well, and they haven't missed a beat, and we should be eternally grateful to them. So the recommendations from your report, Phil, is it's recommended that the Health and Adult Social Care Scrutiny Committee note the contents of this report on the work carried out by the Council during the outbreak, that the Health and Social Care Scrutiny Committee provide feedback on the work and identify potential areas for improvement. So we, throughout the scrutiny process, we will come up hopefully with some meaningful recommendations towards the end of it to go to LGA level, national level and to local level. So we'll keep you informed on that, Phil.
Thank you very much.
That's it for tonight, ladies and gents. Agenda item 6, to consider any questions from members to the chair where 2 clear days notice has been given to the monitoring officer under Council Procedure Rule 11.8.
None received, Chair.
No. Matt, you've just come up live. You're going to speak.
I was going to say goodbye, Chair.
In that case, good night, everyone. Thank you. Thanks very much.
Good night, Chair. Thanks very much indeed. Thank you, everyone.
Thanks, Chair. Good night, everyone.
I'm not quite sure, Chair, where Matt has turned to a very strange shade of blue, but
as a Man United supporter, he shouldn't be blue at all.
No, you're right.
Yeah, very true. Man City blue, that is, Matt.
You can blame the council's lurid lighting for that, Chair.
Or Smurf.
Thanks again, all.
Thank you all. Good night.
Good night, all.
Thank you. Good night.